G'day, I'm Ian Campbell from Palliative Care Australia. Welcome to Thursdays at 3, PCA's new video and podcast series that taps into conversations with people living and working at the end of life. Whether you're tuning in through Spotify, YouTube or our socials, welcome. Thanks so much for being here. Today we head to regional Queensland, dropping in on Fraser Coast Hospice, a community-run 6-bed purpose-built facility at Hervey Bay, just south of Bundaberg. Gari, formerly known as Fraser Island, is just outside the window. And as with any community-led initiative, there's a lot of heart and soul that went into making the Fraser Coast Hospice a reality, not to mention the heart and soul that's part of this place every single day in the support they offer people living with life-limiting illness and their family and friends during the last months, days and weeks of their life. Joining us today is the Director of Care of Fraser Coast Hospice, Alicia Trimmingham-Turl. Thanks so much for your time today, Alicia.
Thank you, Ian, and thank you for the invitation to talk about Fraser Coast Hospice.
Pleasure. You took your first client in October 2021, not too long ago, really, a relatively new service, but the journey started in 2018. What's the backstory, Alicia?
So our founder is Jacine Leslie. She's a registered nurse who works in radiation oncology here in Hervey Bay. And she was caring for, into 2018, for a patient by the name of Sally. And Sally was presented for her radiotherapy treatment, but was really unwell at that time and had to be transferred over to the Hervey Bay Hospital. And unfortunately, in 48 hours passed away in the short stay emergency. So Jacine was really troubled by there not being a hospice type a facility or palliative environment where people could spend their last days. And she got together with a group of like-minded health professionals in Hervey Bay, and they made a submission to the federal government and was successful to receive some funding that built the building of which we're in now here in Arraween in Hervey Bay, and gave us some funding to get started for the first couple of years of the service.
Such an extraordinary achievement for a small community.
Yeah.
There's a bunch of flowers that are really important to this story. Tell us about the bunch of flowers.
So once Sally had passed away, her husband actually sent flowers to the staff at the radiotherapy unit where Jacine was, and those flowers became the inspiration for Jacine and the group of like-minded individuals to get the project off the ground. So they've become Sally's Flowers. We actually have a beautiful canvas print of those flowers in our reflection room at the hospice. And we also had a local artist who has done an artist impression of those flowers, which is proudly hanging in the hospice as well. So they're a constant reminder.
Yeah. Must be very special for Sally's family to know that Fraser Coast Hospice has come from her death.
Yes, very special and very important, yeah.
Here we are talking about hospice care, Alicia, but I'm really aware a lot of people might not know what hospice care is or what a hospice does. What's the elevator pitch? How do you explain it?
So a hospice is a place where we provide inpatient 24-hour round-the-clock palliative care for people who are suffering from a life-limiting illness. We accept people for admission who are at the end of their life, so that means they might be within the last weeks or days or hours of their life. We accept people who are suffering with symptoms that need to be looked at and treated, and we help them with those symptoms and possibly, hopefully, get them back home so that they can continue to be at home. And we also offer respite, and sometimes that respite is for the families who are caring for their loved ones at home. So we have a registered nurse and personal care assistant 24 hours round the clock. And we also have an admitting doctor who coordinates basically the admission, the palliative admission for the client. We have a very relaxed, peaceful environment. We encourage families to come and go as they please. We don't have any set visiting hours, and we encourage family to stay overnight. And we also encourage four-legged visitors and the likes to be. They're very important parts of people's families. So we encourage dogs and cats, and we've, I think, had a few birds and guinea pigs even visit, which has been lovely. So we just want to really, what we're creating, and what I talk to people about when families or even clients themselves look through the facility, is that it's a compromise between a hospital environment where you have that medical and nursing backup, and home, a place where you really want to be and where a lot of Australians do want to be to pass away. But clients can have that, and families can have that relaxed atmosphere, knowing that there's a nurse available or the doctor available to help with any symptoms or things they might need.
It provides a choice to people, doesn't it?
It does provide
another choice. So, and I guess empowers people's decision making at that critical time of their life.
It does. And one of our main part of our strategic plan was to create transfer pathways for people directly from home, so palliative patients at home to be able to come straight to the hospice without having to go through the hospital. And that's really important to know, that for families that we have that available if they're struggling at home. And sometimes that does happen, and it's also reassuring them that because someone's come into the hospice, it doesn't mean that they haven't done well at home. A lot of families do really well for a long time at home to care for people. So, and we just provide that last little bit of support for them.
Alicia, how do you keep the lights on? Yours is a free service. How do you stay afloat?
Well, as I said, we were very fortunate. The federal government in 2018 granted us money to build the building of which we're in. The Fraser Coast Regional Council, Peppercorn leased the land to us, so we didn't buy the land, we don't pay anything for the land. So the Fraser Coast Regional Council has been very generous as well. We are coming to the end of that federal grant, so we have started an intensive promotional as well as fundraising activities in the community to help us keep this going. Even today, one of our retirement villages, they put their heads together in January and on Australia Day, they asked all the residents in their living area to donate some items for an auction, and they got 124 auction items and auctioned them all off after Australia Day breakfast and raised $1,735 for us. And they dropped that off today. So it's that sort of thing that helps us keep the lights on, that helps us keep providing that care. Yeah.
Volunteers play such a critical role in the delivery of palliative care services right across Australia, and perhaps in a way of no other sort of health service. Volunteers are just so critical to palliative care. What role do they play there at Fraser Coast Hospice?
We have volunteers right from the very front door, front of house greeting, answering telephones, helping visitors find their way. We have volunteers in housekeeping, in our kitchen. We have volunteers mowing the lawns and helping with gardens. We have volunteers who help with fundraising as well. So a large cohort of really dedicated, wonderful local people who are helping us to provide the service.
Mm-hmm. What sort of place is it to work, Alicia? I imagine it's a place of tears and laughter. The end of life can be a magic time of life as well if it's done well. What sort of place is it to work for you? A place of laughter and tears?
We have a balance, yes. we need to create that normality that people have at home, where the washing's done, there's meals around the kitchen table, and we have a kitchen table in our family room. We have the laughter, and we have the tears, and that it's not just affecting families and the people that are visiting us. It also affects our staff and volunteers. So we have that balance between life and living it to the very end, but also that respect for the loss of very loved people in our care. Yeah.
What drew you to palliative care, to end-of-life care?
Well, I became a registered nurse in 2001 and worked in medical and oncology nursing, and I think I was drawn by being able to help people who really, really need help in such a difficult time. So I was fortunate very early in my career to work in another hospice in Queensland. Back in 2003, I spent 12 years there, and it was just such a privilege, and it continues. I stepped out of hospice back into acute hospital nursing a couple of years ago, but it became really apparent to me that the privilege to care for people and their families at this time in their lives, and how much difference we can make, and how if the care is really good, we can help families be resilient, many years into the future. So, yeah, it's very.
Yeah.
I find it rewarding. A lot of people over the 20 years I've been nursing have said, "How do you do that? How do you look after people who are dying all of the time?" But for me, it's a privilege, and I think it's something that I'm able to do. I think that's what drew me in. Yeah.
The heart and soul that goes with this work is really obvious, but I imagine that translates into your personal life as well, and your own end-of-life planning and those sort of big discussions about life with family and friends. What have you learnt about life that you bring into your life outside of work?
I think it's really important. Australians, well, as a society, we don't communicate very well about death, and we don't like to talk about death. We don't like to plan our death. But for me, I've made sure that I've told the people that I really love in my life what I would like at the end of my life, and I've worked at making sure I have my affairs in sorted, like my will and EPOA and those sorts of things, and statement of choices, and making sure that people that are going to make decisions for me at the end of my life know what it is that I want. Yeah.
Alicia, just touching on, I guess, the here and now and some of the issues that the palliative care sector and the health sector more broadly are dealing with, and certainly staffing issues is one thing that's front of mind for a whole bunch of sectors right across the Australian economy. How are you going with staffing pressures at the moment at Fraser Coast Hospice? Do you have everyone you need?
We have certainly had some challenges around staffing. The world pandemic hasn't been helpful with that in terms of illness and healthcare workers needing to be away from their health care facilities. But we have been very fortunate to have had some really good quality nursing staff apply for positions and who are working at the hospice. One of the workforce issues we have encountered is perhaps not so much training and experience in palliative care in a regional area, not having other palliative facilities in the region where people may have worked previously. So we are very committed here at Fraser Coast Hospice to educate our staff as well as we can and provide as many resources for them to be able to grow and become specialists in palliative care themselves. So they would be the main challenges, but generally we have an awesome group of registered nurses and personal care assistants who are providing really good palliative care, and they're very keen to learn, very keen to do well and look after the members of our community.
Alicia, you touched on that sort of regional setting that you guys live and work in, and often in regional communities, the primary health care providers, the GPs, the nurse practitioners, the RNs are the frontline in local health services. They must play a huge role for you at Fraser Coast Hospice, those primary health workers.
They do. Domiciliary nurses out in the community palliative care nurses from the local health service district, they absolutely do play a huge role for looking after people in the community prior to coming into the hospice. And we've worked really hard to foster the relationships with those practitioners out or healthcare workers out in the community.
What's your pitch for working in the palliative care sector, Alicia? Or if you're an RN or a doctor and you might not necessarily have that palliative care experience or those palliative care skills, what's your pitch to those people to get involved, to get those skills?
I think palliative care is a really rewarding career. It's a specialised area. It's something that you can develop some really good skills in and really support the people generally, their community, their families. I think it's really rewarding to go home at night sometimes and know that you've made a difference to people's lives. Especially, I find that when we have phone calls for admission when someone's at home and they're just not coping, they just really need to go to be cared for in a facility. The family's just so relieved to be able to come into an environment where they can be part of the care and know that we're available to help at any time, right around the clock. So I think the message is it's just a rewarding career to get involved in.
Alicia, you just touched on something really interesting there around the family being involved in the care and working with your staff, by the sounds of things, to deliver the care to their loved one. That makes hospice care really different and unique, I think, that relationship between staff and family.
Yes, and when we show people through the facility, when we do encourage families to be as much a part of the care as they want to, or just be there and let us do the caring. It's really interesting. A lot of families will, a lot of spouses or children of terminally ill people will feel like they've let that person down because they wanted to die at home and they just couldn't get to that point. So it is really good to be able to say, look, you can still come to the hospice. We can provide the bed, the room, the nursing staff if needed, but you can still do as much of the care as you want to. I think that's what makes people feel more at ease, that they're not letting their loved one down.
Yeah, and they can be the husband, the wife, the son, the daughter, rather than the carer. Yeah,
that's it. Yeah, and they've got that option right through to the very end. And some families like to participate and help with the cares right till the time of discharge from the facility. So, and that's really, it helps with their resilience into the future of through their grief journey as well.
Alicia, just briefly, voluntary assisted dying, or VAD, is something that our community is working through, and VAD became an additional end-of-life choice for Queenslanders in January of this year. Other states and territories are on their own journey with VAD. But what's been your experience, these sort of few weeks down the road from VAD becoming a reality in Queensland? What's been your experience? What are the insights that you can share with us?
Fraser Coast Hospice is not participating in voluntary assisted dying. We're not providing voluntary assisted dying services, but we are respecting the choice of our clients. And if they request information about voluntary assisted dying or accessing VAD services, then we will work with their doctor and with them and with the QVAD support service to ensure that we meet their choices and their needs.
Again, end of life should all be about choices, shouldn't it? And
It absolutely should be.
being able
And
to access what they need. And
respect for their choices, yeah.
Yeah, well said.
Absolutely.
Alicia, given the success that your community has had in establishing its own hospice, have you got any advice for other regional communities around how to do this, how to get the ear of a politician, how to get the funding? What worked for you guys? How did you do it? Any words of advice for other regional communities who would love their own hospice?
Well, I wasn't involved in the original submission with the original building committee or the project committee, but I know that they spent a lot of time thinking about what they wanted for Hervey Bay or for the Wide Bay region or the Fraser Coast region, and they met with a local member here at the time, and they were successful with their bid. So I think it's persistence, and it's getting out into the community and helping the community understand how important hospices are, or how important palliative care is for number one, but certainly how important hospices are, and having a facility where you can provide just palliative care and people can have that experience. So it's persistence, but the original project committee did some fantastic, very lengthy, very committed work to establish what we have now. So
we certainly need to do more and do better for making palliative care more accessible in regional and rural communities, and Fraser Coast are leading the way. Thank you so much for your time today, Alicia. Thanks for sharing your work and your wisdom with us, and congratulations on what you've achieved at Fraser Coast Hospice. It's really inspirational. Thank you.
Thank you very much for the opportunity, Ian.
And whether you're tuning in through Spotify, YouTube, or our socials, thanks for being here. Thanks for taking an interest and engaging with one of the big last taboos of our society, death and dying. Thank you for your interest. I'll see you again next Thursday at 3 o'clock. In the meantime, head to the Palliative Care Australia website and explore our tools and resources. Ta-da.